Good morning. I'm Dr. Kamalika Mandal. I'm one of the consultant neuropsychiatrists working in Siliguri. Today is 24th of May, and this day is designated as the World Schizophrenia Day. The schizophrenia, the term, really fears us, scares us. However, what I want to say is that schizophrenia, yes, it is a mental illness, it is a daunting mental illness, but nowadays there are reasons not to be so scared of this illness. Schizophrenia is one of the most common and dangerous mental illnesses. It affects a population of around 24 million people in the whole world. And if you consider India, then around 8 million people of India are suffering from schizophrenia. However, this number may be a bit different from the truth because there are lots of people who are not diagnosed, who are not even taken to the doctors to get proper treatment. So, this is a high time that we should bridge and break the myths, the shame of schizophrenia. Let's focus on the illness itself. Firstly, this illness, in most common way, emerges in late teen or early 20s. Usually, the onset is a bit tricky. I will say the mother sometimes inform us that now the child is a bit isolated. He is not talking to the friends. He is mumbling to himself, and sometimes he is becoming very angry without provocation. On asking, on interrogating the patient, or while trying to understand the patient, we got to know that there are certain symptoms that are present in that person. Firstly, delusion. What is delusion? It is a firm, fixed misbelief. It is a disorder of thought. When the patient thinks that someone is spying on him, or someone is following him, or someone is trying to control him. However, in reality, this is not the story. Even that if we try to mitigate that thought by giving evidence, the person is firmly and fixedly believe in his own thought. So this is known as delusion. There is a distortion of his own reality, and the person who is suffering from schizophrenia didn't know which one is true, which one is false. First. Second thing, there could be something known as auditory hallucinations. It's a disorder of perception in which the person will hear voices, noises, those are derogatory in nature. Sometimes they hear voices threatening them while others are unaware of it. So there is a world where he lives, where the world he thinks that it is true, but others couldn't uh, get into it or understand it. Thirdly, there could be some other symptoms also, which we refer to as negative symptoms, like poor self care. There is no bathing, there is no brushing of teeth, there is no combing of hair, there is no emotion in the face, there is decreased interaction. That guy or that girl is not talking to any of his friends, not taking care of it, of him or her. So, these are the negative symptoms of schizophrenia. So, yes, the reason, now I'm coming to the reason. It has been misunderstood by different people, like bad parenting could be a reason of it, or that this symptom is known as this illness is known as split personality disorder. However, it has no relationship with these myths. The cause of schizophrenia is multifactorial. It can be genetic, yes. Family plays an important role. It is genetic to some extent. However, substance use like cannabis, ganja, LSD, marijuana plays an important role. Stress, not when a person is not sleeping properly, not taking care of his lifestyle, that could be also an additional trigger or precipitating factor of this illness. Lastly, I want to say is that uh, the patients with schizophrenia, they are so much stigmatized in this society. What I want to say is that schizophrenia is nowadays very much treatable. There are early interventions. If you bring the patient at the earliest, the chance of recoveries are quite well. There are lots of patients who are schizophrenic but are working as a good nurse, a better doctor, a better engineer. What they need to do is that they need to go to the doctor at regular interval. They need to open up about their thoughts, about their queries. And last but not the least, the family members of the schizophrenia. Dear, you are the heroes. Don't be disheartened. Uh, it is the responsibility of the doctors and nurses to psychoeducate the patient and patient's relative regarding the symptoms of schizophrenia, and to pick up the early symptoms of schizophrenia if it relapses and come to the doctor as soon as possible. It is true that suicidal activity, aggression, anger are quite common in schizophrenia, but please don't be scared. There are medications, there are treatments to help the patients of schizophrenia. So you are not alone. It's a high time to breach the shame, to breach the stigma, and live a healthy life. Thank you very much. Let's be together in your fight. Thank you.